The knowledge base of what we do in medicine needs to have advanced to the point where you understand what a cell secretes, how cells communicate, and what growth factors are, and what an exosome is, and the different types of stem cells. The medical industry as a whole, and in particular, I think big pharma, realized very early on that cell therapy was the way the human body works, and they had to get ahead of the narrative before the science of using your cells to help you heal got kind of out of control. All right, so as you can tell, I'm not surrounded by co-hosts today because they all ran from the room like the Home Alone kid because we want to talk. This is gonna first. Let's just say this is gonna be an adult episode. I think that if there are children in the room that you don't want hearing anatomy, the correct anatomic terms associated with sexual wellness, if you don't want those anatomic terms used in front of people that you're around, then maybe this is a good time to skip over to one of the other episodes, maybe watch about us opening our clinic in the but for adults and for our patient base, I think this is a really important topic because it fits all of our criteria on a medical treatment, meaning that if you've watched any of the episodes, you know that even though I'm fellowship trained orthopedic trauma surgeon, so I for sure understand the anatomy, physiology of orthopedic reconstructive surgery. But I think that there are certainly a lot of health issues that are so multifactorial that there's not one really all-encompassing treatment that makes someone better. There's especially with sexual wellness, because it's about hormones. It's about certain peptide deficiencies in the processing of the hypothalamus as you get a little older, or about the decrease in arousal that you may experience. And it's not all just about structure and function. So I think that when we talk about sexual wellness, at our clinic, we kind of call it couples therapy, because there's usually some part of a couple's relationship that is affected if there is intimacy issues. And I think that because the people that you're intimate with in your life and that relationship is so key in your overall health, your overall mental health, your overall coping mechanisms, your ability to avoid depression and anxiety. It's really about the most intimate relationship that you have in your life. And there are so many reasons to fight back against aging, stress, pain, a lot of the other medications people take. That I think that we have a lot of very useful toys. And I say toys because there's a lot of little niche treatments that it doesn't always have to be the biggest thing possible. Like you don't have, this is going to be the first time we start using anatomic terms. So this is your opportunity to rush people out. I think that it's not all about not being able to attain or maintain an erection every time. So it's not like, well, when this isn't working, we go on testosterone. And if testosterone doesn't make a big enough difference, I just need an implant. I think there's a lot of steps that need to be taken that work. And some of them are very, very easy. There's a lot of, and we've done a ton of episodes on peptides, but what we've never really done is taken a deep dive on the sexual wellness side of peptide therapy, especially from a couple's perspective, because there are some individual differences on the male and female side of peptide therapy when it comes to sexual arousal, the obtaining of orgasm, the ability to experience pleasure, and that emotional connection, that there are peptides that can make a big difference. For sure, this is one of those topics where there's usually some lab involved, right? So, when someone comes in that's having a lot of back pain, I think back pain, neck pain, obesity, those are issues that we deal with all the time in the clinic. And a lot of patients don't get to the point of discussing the secondary sexual issues because a lot of doctors feel uncomfortable with it, which is kind of silly. And because the patient feels uncomfortable with it, which is not silly, because you can only be open and discuss things that are kind of on the table to discuss. I think in our clinic, when you start doing a history on someone that's in chronic pain, especially if you're having to take a lot of narcotics, if they've previously been on a lot of narcotics, if they're on certain muscle relaxers, if they've had blood pressure issues because of their obesity, if they're having some secondary diabetes issues, all those contribute to sexual dysfunction. And I think understanding that is crucial if you're going to start treating it. So let's start with some of the easy things that we do in the clinic. I think one of the easiest, most important things that a couple can do if you're having some bonding issues secondary to someone being in chronic pain, number one, get your pain taken care of. If you've got a bad back, it doesn't matter how much you love someone and what your testosterone level is. If you've got so much pain when you're in certain positions that you can't think about anything except for the amount of pain you're in. And so for certain, we need to help you address the primary issue before we get to some of the cleanup. And I think of sometimes sexual wellness is the primary issue. And if that's the primary issue, make sure that you're willing to have that discussion with your physician because there are ways to address that aren't just getting your testosterone up. If people are coming to us for testosterone therapy or hormone therapy with women, pellets or injections or creams, however we're going to address it with you based on your levels and what you're tolerant of and how you respond to treatment, let us know the goal. I think that if someone's coming for testosterone therapy, it's not always assumed that you're coming because of sexual dysfunction. I think that most patients assume that, but most physicians don't. And I think that sexual dysfunction is way more multifactorial. You can get your testosterone normal and still not see a big difference in overall sexual wellness because sometimes you're a secondary estrogen producer and we need to help block some of that. Sometimes there's pain involved with your back. So our goal is let's get everything on the table so we can help you kind of pick and choose the flow chart that you're ready to kind of venture down, right? So I do think that the easiest way to help that with a lot of patients is peptide therapy, especially with women, because if the main focus, first of all, it needs to be known to let you know that it's not just you, right? What's published is greater than 50% of women over the age of 40 that have had at least one vaginal delivery rate orgasm is either almost never or only with great difficulty. If that was a male statistic, there would be no blood pressure meds developed on the market till that was fixed. If you're a female and you go to the doctor, they're going to give you a little testosterone cream and tell you, sorry about your bad luck, I guess, but they don't really have ways to address that. And that's just not true. But because of the secondary dysfunction, or what's referred to in medicine as anorgasmia, or the inability to achieve the climax, that also leads to the secondary decrease in arousal. If it's just about the decrease in arousal because you've had some other issues with your partner, then there's a peptide called PT141. The old brand name for it was Vilesi. It's just peptide therapy. And with that peptide, what's been shown is a dramatic difference in the recognition of the need for arousal and the addition of an increase in sexual performance. And that's for both men and women. Melanotan 2, more on the male side. It's actually even referred to sometimes in the literature as the erectile peptide, because it makes such a difference in overall ability to attain and maintain erection. The contraindication for that for some people is it can cause a lot of nausea, but it's not a peptide that you take like you take. It's not like taking Cialis or Viagra, which are still fine options if you respond to them. And if you're always in that window of opportunity trying to anticipate that with drug. But most patients that want to talk about sexual wellness want that return of spontaneity back. They want to be more in control of not having to anticipate and dose drugs around it. And that's what peptide therapy does. If you're on melanotan 2 for erectile quality or for returning of erectile function, it's a small amount, and we discuss that based with the patient individually on where we start you. But usually, just take it at night before you go to bed. It actually aids in attaining normal sleep patterns again. But it's one of those peptides that has its effect as long as you stay on that peptide, if that's what you're deficient in, until we get you healthier or where you're not obese or where you're not in pain, and maybe your body kind of resets its own normal. But melanotan 2 is the only real side effect we've ever seen in the clinic is a little bit of nausea. So it's not one of those peptides I would do in the morning if that's my goal. Melanotan 2 is one of those peptides that 2 or 3 times a week, depending on your response, we've seen a significant change. PT141 is the same kind of way. Matter of fact, a lot of our patients will alternate between 3, kisspeptin, PT141, and melanotan 2, and that's in women and men. Hormone therapy obviously is kind of the clutch. We can do everything else right, and if you have 0 testosterone as a woman or your testosterone is extremely low as a man, it can be extremely difficult just focusing on in-organ treatment if we don't have you systemically well. I think that the orthopedic part of sexual wellness is, what do we need to do to get you out of the inflammatory mess that your body's in? If it's a disc in your back or certain medications that you're on, that's why it's so important, because a lot of people don't even know that some of the medicines they're on are causing some of the sexual side effects. And so there's a certain part of a consultation on sexual wellness that's about, are there some things you're doing that's just kind of getting in your own way? Some of those things are it's not reinventing the wheel to solve some of those first. Then in the end, and I know most people that are coming to us to talk about sexual wellness are coming because of the biologics treatment that are very well published and with dramatic results for a lot of people that have kind of exhausted all their other possibilities. And they're to the point of either giving up or they're to the point of it's affected their relationship, it's affected their overall sense of well-being, and it's affected their ability to even open up to someone else because they feel like they're set up for failure. And when you get to that point, when people show up at the clinic, we just need to know if that's where you're at, because sometimes our flow chart may include some things that we would skip over if we're wanting to talk about biologics and the treatment for sexual wellness, because especially with men, and I shouldn't say especially with men, because the treatments for women involving the biologics, one of the other treatments has been the O shot, and we've done those courses. I'm very experienced with PRP. The O shot is a system of injections using PRP. I have the certificate involved in that 10 years ago, longer. And that could be very foundational for a lot of women. And it's called the O shot, but technically it was originally being used for stress urinary incontinence. And that's a significant also part of sexual wellness in women. If you have stress urinary incontinence, it's very difficult. And I had a woman describe it to me, patient describe it perfectly, who said, I work so hard to be fit because I want my husband, because I feel like I owe it to him to be desirable. And I put in all this hard work, but it's really hard to feel sexy when you're wearing a diaper to the gym. And she goes, if you can't do a jumping jack, or I can't laugh at a movie, it makes it extremely difficult to go right from that to sexual arousal. And I never really thought about that. And she's exactly right. And so I think that addressing the stress urinary incontinence is one of those things that with the biologics we've done we've addressed very efficaciously. It works. It's made a difference for a lot of people. It's been around for a long time, the series of injections, periurethral. What happened, though, in that study, and this years ago, is that women would call back after a few weeks, and they would say, wait a minute, I haven't really felt pleasure in a really long time, and I was in the shower, or I did this, and holy moly, like, is that common? And the answer is yes. Now, with that as a backdrop, because you're injecting around that pelvic plexus and around that tissue on a woman's urethra, and now that injection series involves the clitoral in portion of the injection, periurethral, and the superior vaginal vault around what was commonly referred to as the Grafenberg spot or the G spot, and there's even some significant injection procedures just called the G shot injection that is just the G spot. And I think it's more than just one area. I said our treatment program on that, and we've made some significant anatomic changes over the last 10 years in the way we perform that shot. And because of our use with other tissue proteins and with bone marrow, the stem cells from bone marrow being used for that injection, because the results hold up so much longer than just with PRP, we have renamed that procedure VNU. And VNU, that injection series is clitoral, periurethral, and the superior vaginal vault down the path of that nerve to the G spot. Though that series of injections is dramatic on the stress urinary incontinence portion, and we've had results on that hold up for several years. And actually, some of the very first patients we did almost 10 years ago were people that either had bladder slings and hadn't done very well with them. And then there's a recall in the mesh, and they're looking at another surgery. And if the first surgery didn't work, why are they going to have a second one? Or it's patients that had kind of exasperated their options and were being told they needed a big surgery and were trying to avoid it. And in those patients, they've been extremely successful at avoiding a secondary surgery or avoiding a surgery that didn't help them very much, and then getting their results augmented with that injection. So I think the biologics injection with bone marrow for women, the VNU, has made a dramatic difference. It was basically focused on stress urinary incontinence in the beginning. It very much turned into a sexual wellness treatment. The things that can make that work better, there's a radiomagnetic chair that a woman can set in that we have at the clinic. And what's published with that treatment is that 6 30-minute treatments has resulted in a dramatic relief and in stress urinary incontinence symptoms. And, by the way, has dramatically increased the orgasmic potential and ease of sexual arousal, because the equivalent of one treatment in that chair is like 20,000 Kegel exercises. To do a Kegel correctly, which I think Kegel exercises and pelvic support, and obviously if you've watched anything we've talked about, I think muscle mass is very important in overall health and wellness. Muscle mass of the pelvic floor, extremely important in sexual wellness. And to maintain ability to function and not have stress urinary incontinence symptoms. You can actually laugh at a movie, and if you have good pelvic floor. But part of a Kegel is you have to have something against resistance to push against. There are some Kegel devices on the market that we've recommended in the past. I think can make a dramatic difference for women seeking that treatment on their own. I do think we can help a lot. I think that the treatment with electromagnetic contraction that we can get by sitting in a chair in the clinic for 30 minutes is fairly dramatic. The results have been really well published, and I think that is an additional treatment on the sexual wellness side. It sometimes can be used in lieu of, instead of, because it can be significantly less expensive just to see what 6 treatments in the chair will do for you. But in anyone that we're doing the injection sequence on that is local enough to be able to do 1 treatment a week for 6 weeks or 2 treatments a week for a couple weeks, it obviously can make a fairly significant difference in, and we're a big believer because of the results we've seen. I think the Biologics injection series that we've done and the growing or the expansion, the more knowledge base of that procedure that we've obtained, the better that injection sequence is focused. And part of that is just to know what your goals are. Again, if someone comes in and they have 0 problem with sexual arousal, but they have a significant problem with stress urinary incontinence, we alter the injection sequence and we base it on the patient's need. If someone isn't to that point yet of needing stem cells from bone marrow, but we could do it with PRP, that's a lot less expensive. It's done under local with a cream, and it's an easy, tolerated procedure. I don't think we've ever had a woman in the clinic stop mid-procedure because it hurt. I know for sure we haven't. So it's one of those procedures that can sound a little bit more painful than I think it is. With men, the injection sequence on intracavernosal, and this is when you talk about the penis, it's divided into kind of 4 spaces: the glands or the head of the penis, and then the 2 corpus cavernosum, and then a 3rd space in kind of the inferior kind of front. Intracavernosal injections with bone marrow aspirate concentrate, or the stem cells from bone marrow, was published in 2009 as a dramatic solution for erectile dysfunction, because what was published in 12 men that are all over 70, status post-prostatectomy, and failure to orals, was intracavernosal injection, one injection on each side with the patient's own concentrated bone marrow, which you got to remember, over 70, chemo at no prostate. Those patients' bone marrow wasn't the best quality bone marrow in the world, and they still 11 out of 12 men at 2 years were still having spontaneous erections. So when someone says, "Does that work?" Yes, it works. There's great data on it. It's very well published. Again, it's one of those searches that you don't do on Google, Bing, or Yahoo, because you're gonna, it's controversial. It's not controversial. It can't hurt you. The downside, again, going back to the podcast name, right? Like there's very little downside associated with that procedure. It can't hurt someone. It can't make you worse. And it's certainly not that painful of a procedure, especially if you're having bone marrow drawn, because that means you were asleep. So with a sedation anesthesia, you wake up and it's over and you go to lunch. And there's no sexual downtime. It's not like having a prosthesis put in that you're going to limit someone's function for a while. I think that's one of the most common questions we get is, after I have that procedure, when can I, it's like buying a new car. You want to drive it, right? So I think that the answer is that day. The same with most of the treatments that we're talking about. This isn't one of those things where does your recovery and your result continue to evolve over a period of several weeks? Absolutely. Especially with women. I think the first thing you see is they can obtain sexual arousal and being able to have lubrication is one of the first things that comes back. That usually is within the first week. The stress urinary incontinence starts to go away very quickly. That's probably the first symptom that it responds. And then I think the orgasmic potential dramatically returns over the first 6 to 8 weeks, and kind of at about 10, 12 weeks, that's pretty much where you're going to be. If we treated you with PRP and you're still not well enough, I up the ante a little bit. If we've used bone marrow and you're at 16 to 20 weeks and still not where you are, then maybe retreatment, or we need to dress you with the chair. We need to get you on the right peptides. We need to do hormone profiles. There's some steps that we could still do to augment your result. But overall, in our clinic, the use of the biologics for sexual wellness, if we're talking about specifically sexual organ function, not overall sexuality, right? But just the function of your sexual organ can determine a lot on how you feel about the act itself. I think that the biologic treatment in our clinic, we call it the ED shot because it's very descriptive, I think. And on the female side, we address that because of the difference in solutions that we use and the difference in the injection sequence when it's performed by a surgeon, and some of our use of a catheter, our use of some of the things that we do in the clinic for those injections is a little bit different than what was published in the O-shot, even though I've done the O-shot training and all that. I think it's a little bit evolved over some of that, and so that treatment in our clinic is called VNU. I think now that we've kind of everyone can kind of take a breath, like the elephant's out of the room, right? Like we're not talking about injecting your clitoris and around your vaginal vault and your G-spot and the urethra. We're not talking about penis and the injections on the side where guys have trouble, visualizing that. Remember though, on when you're talking, especially when you're talking about a penile injection, it's a 31 gauge needle. Like it's extremely small, and oh by the way, the injection's small. By the way, when you're talking about the injection, there's a third of the world outside of the U.S. that performs an injection 30 minutes to an hour before sex every time they want to have sex with papaverin or some of the intracavernosal drugs that are out there. That is the end-all treatment for erectile dysfunction. And we still prescribe some of those. There is, especially in someone that's just completely metabolically broken, they've been diabetic for years, or they had spinal trauma, they have insensate issues with neuropathy. There are drug treatments all the way up to what in our clinic we would just refer to as trimix. That is a mix of 3 different drugs done through a compounder that you keep in your fridge, and 30 minutes to an hour before you're going to plan for that activity, you pull 0.1 to 0.3 cc's up, depending on your dose response. We start you at a low dose and work up. Again, it's a very individualized treatment with very different responses. But it's one of those treatments where it's going to work. And just restoring sometimes even when someone's going through some of the sexual wellness injections, we may use that drug with the patient to help get those initial couple responses out of the way so that your body gets used to that again, which is key. And there's sometimes we need to help to get you up the mountain. Sometimes we got to do a little bit more pushing, and we certainly have a way to take anything we've done and continue to make it better until we get you where you want to be. I think that the other side of that, now that we've kind of addressed end organ dysfunction, because I think in sexual wellness, we tend to, especially as physicians, and I think even as a patient, you tend to think, well, if you're not having an orgasm, it's either in your head or it's vaginal dysfunction. Or if you can't achieve an erection, it's either in your head or something's wrong with your penis. And that's just not true. It could be, but it's certainly more multifactorial than that. And sometimes it's as easy as if anyone's ever heard of oxytocin, I think probably everyone that's ever had a baby has heard of oxytocin because it's one of the lactation hormones. But if you look at the literature, again, outside of Google, Bing, and Yahoo, we were talking about the search a minute ago. Search up bone marrow stem cells for erectile dysfunction on DuckDuckGo or Brave or Tor Server or Google Scholar or PubMed, and you're going to see a dramatic amount of literature, including clinical response literature, not just a bunch of rat studies, that showed a dramatic difference for a lot of people. This is not something that is new. It's not something that should be controversial at all. And it's not something with any of the downsides of a lot of the other medications out there. I mean, one of the, in my head, when I start talking about something, what always comes up is a lot of specific patient examples of questions I've gotten. One of the patients that we had been treating for his back a long time, he had gotten a lot better. He's doing well. And it's finally the follow-up question to him is, okay, hey, now that I'm not hurting all the time and I'm not taking all this pain medicine, I'd kind of like to be able to have sex with my wife again. And because it's been so long, because every time I'm hurting so much, and with the pain medicine, she felt like she couldn't. I was frail, and then if we tried, it was a failure, and it put distance between us. But now we're ready, and things feel like they're kind of ready. But I'm having to take so much, Viagra to do it that it gives me a bad headache. Like it's, no one wants to have sex if you got a bad headache, and so because a little bit didn't work, I started taking more. The doctor didn't tell me to take more, but I thought, because a lot of patients think if one doesn't work, two should work. And then they get a headache or they have a lot of nausea, they're seeing blue. Like, I don't really want that. Is there any other way? Well, you're like, absolutely, right? So then, because a lot of patients, even depending on the age of the patient, and the average age in our clinic on the sexual wellness injections has been right around, actually it's dropped over the last several years. It used to be only people in their 70s that were even willing to talk about it. And now it's dropped into that, 50 kind of mid-range, because there's a lot of people having a lot of testosterone issues much younger, and because of pain and other medications and, processed food, that have had significant erectile dysfunction symptoms at much younger ages, and that's very well published. So the age of these treatments has all dropped. But sometimes it's as easy for a couple, if you think of it as couples therapy, unless you're single and not with a partner, most sexual dysfunction, if it affects you, it affects your partner. And they may be having a lot of emotional issues even talking to you about it, because they don't want to make you feel like you're not the man they want you to be. And if you're the man, you don't want your wife feeling like she's not a good wife and taking care of you. And so I think that sometimes it could be as easy. There's a hormone called oxytocin that there are some compounders we work with that make a gummy. And if you look up oxytocin, there's the kind of the layman or the slang, the way it's been addressed, and a lot of, like, if you're reading sexual wellness out of Red Book, right, or Men's Health magazine or Maxim, they're going to call oxytocin the cuddle hormone or the love hormone or the love drug, which, if you take that on face value, if that's what it's referred to as, that's probably been the response people have seen, right? So with oxytocin and an oxytocin gummy, which is easily administered, and we recommend both people have a gummy and then go on a date, right? It doesn't make it where you can't drive or anything else, but it makes you incredibly more receptive. And when you look up that, and you look up the cuddle drug or the love drug or the cuddle hormone or oxytocin therapy, and again, not the Western medicine narrative against it, but the holistic side of it, you're going to find out that it's the hormone responsible for trust, recognition, bonding, and arousal, right? So we give the sexual arousal part of it the biggest credit, but you know what's really important in sexual response of two partners that have been dealing with the sexual dysfunction issue? Trust, bonding, recognition, openness, your ability to open up and even talk about it, right? So sometimes it's as easy as a little bit of oxytocin, getting a woman on a little bit of PT-141, because the drug name for that, when it was a drug, it was really pushed. And now that it's not a drug with patent approval anymore, it's just a peptide. No one will talk to you about it. But PT-141, it can be significant in the arousal side of a sexual response in females. If we've exhausted all the conservative things, you really love your partner, you guys are really working hard. Like there are times where no matter how much you love someone, things just aren't working right. And that's when there is a way to step up the treatment with the biologics or with muscle stimulation, even with men. Obesity, right? Like just some peptide therapy to address some weight loss, some peptide therapy to address insulin resistance, some peptide therapy to address the fact that you're pre-diabetic. Look, if your fasting blood sugar is above 85, you have a problem, right? A lot of physicians incorrectly will tell you at 100, you're okay. Like it's, anything under 100, you're fine. Here's what's published. Like if you want to, this is not opinion, because before I started this journey, I was like my fasting blood sugar was like 108. I had no idea. I didn't have any other symptoms. I wasn't foaming when you urinate or any of that stuff that you talk about, constantly thirsty, any of that. But what's published is for every 1 point above 85, you're at a 6% risk of heart attack, stroke, or diabetes. Someone should tell you that, right? So if your fasting blood sugar is 90, 95, it's not okay. And with some peptide therapy, some diet modification, maybe working on some muscle mass, maybe addressing whatever it is that's causing you to be so metabolically broken from a pain perspective and an inflammatory load, there are some ways to help you get over that. I think that abdominal strengthening, we have a machine in the clinic. What's published is one treatment on that machine is the equivalent to 100 setups a day for a year. I don't know about doing 100 setups a day for a year, but I know that I can lay on a table for 30 minutes on my phone. And if you do that 4 treatments, so 1 treatment a week or 2 treatments for 2 weeks, what's published is a 20% decrease in fat and a 30% increase in muscle mass density and strength at 10 weeks after your 4th treatment. Pretty well published data. That sounds important in my overall sexual wellness. Like if I have abdominal strength and I'm not having a lot of back pain and I can get my glutes back, like all that may be really important part of your overall wellness. I think the peptide therapy, there's more than just the options we've talked about. I talk about the big ones because I think that there's some that are just really easy to recommend because there's such a significant safety profile on them, and pretty much everyone at a certain age is having an issue with those, that there are some really easy ways to really optimize care without being that invasive. I think that muscle stimulation in the chair, if you can tell a woman, I can give you we're going to do 20,000 Kegels 6 times over the next several weeks, I think you'd see a dramatic difference in your pelvic floor support and muscle mass, and oh, by the way, the ability to experience sexual arousal and increase your orgasmic potential. I think the injection sequence is the step that most people wait for before they come see us and talk about it. And I want you to know it's not a complicated treatment. It's not a treatment with any significant downside. The only downside of some of these treatments is it may not work enough. It's not going to hurt someone if you do it the way we've designed it to be done, and get some of the roadblocks out of the way to increase its efficacy. It is one of the more common treatments, which, and I'll tell you just completely organic, is that usually in orthopedics, as an orthopedic surgeon, private practice, 26 years now, 28 years, I think. If I got someone better, they disappear, right? Like, you'll see them at the store. Hey, I'm doing so much better. Thank you. The sexual wellness injections and the hair, the face, those are the cosmetic stuff we've done for people, the peptide therapy. Those are the things that when people see success, you see them on your schedule and you think, wow, I guess maybe they didn't get the response they're looking for. And the first thing I'm like, oh, so did it not work, or did you not notice enough? And they're like, no, it works great. But when can I do it again? Like now that I'm halfway up the ladder, can we repeat this to get me, like, there's a light of hope, right? Like you've opened the tunnel to possibility. So a lot of people are kind of refuse to see it as even a possibility. They've kind of written that area of their life off, which there's zero reason to do. And you give them a little bit of hope and they're like, hey, how long do I have to wait? Like, if I do this again, will it make it even better? And what's published on that in a sexual wellness study out of the Carolinas, again, about a decade ago, even on penile length, what was published after 3 injections, so 1 injection series, and this was just a PRP study, 1 injection series done the way we would do the cavernosal injections. I think it was almost an inch bigger in girth and just under an inch longer at max arousal at a year after those 3 injections, and that held up for the 2-year mark. So if that was someone's goal in that study, and it was really about erectile dysfunction, but that was the secondary, oh, by the way, look what else happened, right? It's kind of like the tirzepatide data on alcoholism. Hey, we did it for obesity, but oh, by the way, at 2 years, about a third of people that we rated as moderate to heavy drinkers just kind of stopped drinking, right? So one of the oh, by the ways was, wow, like we saw a return of girth and length, and we saw an increase in girth and length. And I think that with men, and every man will kind of understand this, and if anyone's had this injection, you've heard me use this term, your sexual organ, your penis, can just kind of feel like an empty sock as you get older. It doesn't feel like it has the same density as it used to have. And one of the things that you see return quickest is that. People will be like, you know, I feel more confidence in addressing the possibility of a sexual relationship without knowing it's going to fail and without building up so much stress associated with it. And I think it's really, really important to a healthy relationship. Hopefully, we're just addressing things that are very sensitive subjects with the patient and addressing it in a very honest, open way with the physician. Hopefully it just makes it easier for you to have this conversation with your physician or with us, and something that is easily addressed and is a very, very common problem for the patient base that we see, because we see people that are kind of metabolically broken or they've had chronic pain. And when someone finds the stem cell treatments with bone marrow and PRP stuff, usually it's someone that has a very chronic issue, and it's almost always affected, oh, by the way, you have sexual dysfunction issues. Because it started with a bad back. It started with then with your back, you gained weight. So this is one of those problems that addresses all of our key points of the things we address, because it's very multifactorial. There's a lot of things going on that we can make a difference in. And I want you to know that this isn't something you need to be afraid to talk to us about, especially if you're already seeing us for another problem. Hopefully, this episode gets used as a resource for people. And hopefully it was informative without being too descriptive. We genuinely, again, the way I try to end every episode is I genuinely appreciate the trust, especially on this subject. I appreciate the trust you put in me by just letting me have an intimate conversation with you that was difficult to have on tape, but I think really crucially important. And some of these things just needed said. You know what? I would be amiss if I didn't add this, because I think it's one of the more common things that men come back after this injection and say. And I think it needs said, even though it's going to be difficult for me to alliterate it correctly. And that is that everyone just assumes that sex feels this good for men all the time, and that women have more difficulty with that. I will tell you that's just not true, and that if men have difficulty as they get older, especially with neuropathy and pain or some medications, even if you can obtain an erection, you may not be able to maintain it because it doesn't feel the same anymore. And part of the injection sequence for the edge shot, if that's the part of the problem, if someone says, oh, it still feels great, I just can't attain to maintain, all those cells go corpus cavernosal. But if it's one of those things where people just say, it just takes forever to achieve orgasm because it just doesn't feel the same, the part of that injection is into the glands underneath the hood of the penis. And one of the most prolific responses that we get from men in that first 2 weeks is they've had such a return of sensitivity that's the thing that they're most akin to on when is it time to get retreated, because man, I didn't even know it could feel like this again. Now that it does, I want to make sure it always does. How long is this going to last? And the answer for most of our patients has been several years. But that is one of the things that I don't think you just give up on. Sex does stand a chance of feeling like it used to feel with the appropriate treatment. And for women, there's even a cream that can help with that on sensitivity side if you're not ready for the injections. But I think that we have a lot of options. There's a lot of medical treatments in our little bag of tricks. So again, thank you for your trust. Thank you for your attention during this topic. Hopefully I was able to cover what people have the questions about that they haven't been able to ask, because I've drawn on all the questions we've already been asked. So thank you for your trust, and hopefully we made it through a difficult topic together and kind of weathered the storm to the end of the episode. So thank you very much.